Hello, good evening, and welcome to Ankle Suppliers. Now, see, in this session, we'll be talking about, say, vessels, that is the arteries, veins, and the nerves, those who are associated with the ankle joint, right? That is the leg. And I think within next 2 or 3 sessions, we'll be able to complete the lower limb because now only the sole will be left out, right? So once we complete the sole, we'll be conducting one grand exam, right? So today is, let's say, Monday. Tuesday, Wednesday, maximum by Thursday we'll be able to complete. If you wish, we can have 1 day holiday for the preparation, and on the Saturday, right, we can have that grand test, and from next Monday we'll start with the abdomen, right? So that's what it is in my mind, and just let me know, right? Accordingly we'll proceed. So screen is visible, voice is clear, video is also good. That is very nice. Thank you. See, after that event, right, everyone is so particular, including me, right? Because that day was hilarious. When for almost 45 to 50 minutes, I taught myself the entire topic. All right. Great. Chalo. Let's start with our today's session. So a small, let's say, like what we shall be doing today. See, today we'll be dealing with knee to ankle, right? Will we be touching all the muscles? Not. Will not be touching few of the muscles. Those muscles will be taking tomorrow, right? Once we'll complete all the muscles, then we'll be having one more session. Means we'll include in tomorrow or day after tomorrow session. That is that muscle refined, and this would be part 2, right? And then I'll be giving you one clean copy also that is unlabeled, which will be for your practice, right? Oh, that is very good. That is very good. Nice to know that you are following the tips to make yourself healthy. Very good. Okay. So coming back to our topic, knee to ankle, right? That is what we'll be talking about. Few muscles, right? Few muscle groups. To be very specific, that is flexor hallucis longus, flexor digitorum longus, extensor hallucis longus, and extensor digitorum longus. These 4 good ones we have not yet touched and will not be touching even today also. Just in case if they'll come in between, we'll have a brief introduction about them. Tomorrow we'll have a deep look at all these muscles plus more muscles, right? So that we'll build the entire sole properly. Okay. And obviously the nerves, arteries, and the veins. That's what we'll really look at. Now see, most of the arteries and the veins, they are quite similar, except 2, right? That is great saphenous and the short saphenous. So we'll have a look at these veins individually, and then we'll proceed for the arteries, and then finally we'll have a look at the nerves, right? So that's how we shall start. Let's move. Okay, here is our first. Just that, like, we have removed the skin and we have removed some subcutaneous fat, right? That has been removed to see the short saphenous, right? This is short saphenous vein. Now this short saphenous vein, see, it is, right, it is behind lateral malleolus, right? It is behind lateral malleolus, and here it is. This is the vein which we have already seen, right? Where it was going above, and which was ending into that femoral vein, right? So this is, and into the femoral triangle, right? That hiatus. Okay, so this is long saphenous vein, right? And obviously this is going in front of, right? So that's the thing, in front of medial malleolus. Good. All right. Let's see further. Here it is. See, this is like a closer look at short saphenous, right? So this is short saphenous vein, right? And as we saw that it runs behind, right? It runs behind lateral malleolus. So that's the important point, lateral malleolus. What will happen? This will go and it will pierce deep fascia, right? So we just say that it would pierce deep fascia and it should drain in some vein, right? Some big vein. And that is popliteal vein, right? So that is popliteal vein. So in exam, I might ask you this question, right? That it drains in short wear, long wear, right? Okay, classically, if you see, this is what, that calcaneal ligament, right? Calcaneal ligament, and this one is lateral malleolus, correct? Lateral malleolus. So this short saphenous is classically in between these two structures, right? It is in between calcaneal ligament and the lateral malleolus. Yes, Ankit, I'm good. Okay. About the long saphenous, as we said, the long saphenous would be passing over the medial malleolus, right? And it will be running on the medial side of the leg. So long saphenous vein, right? Medial side, and yes, it would go all the way and into the thigh. It will drain in femoral vein, right? Obviously in femoral triangle, right? Okay. Now there are few specialities which we need to talk about. Say these are calf muscles, right? Gastrocnemius. To be specific, that's the gastrocnemius, right? So this saphenous vein, right? It is joined by several superficial and perforating branches, right? So there will be some superficial vein, because see, these are the leading veins. So there will be some superficial veins, right, which will come and drain into it. There would be some perforating veins, right? Perforating veins coming from deeper planes. So they'll perforate this fascia, they'll come to the saphenous vein and will drain into that, right? And here is how they will really look like, right? These are what is called as the perforating branch, right? So we know this part very well, right? Now, so you must have practiced even this figure also, that okay, this is tibia, this is fibula, right? Then there is that interosseous muscular septum, and because this tibia, that shin is superficial, so we just draw it like this, and then this fibula, right, it just goes like this, anterior crural and the posterior crural, right? And this gives lateral, this gives anterior compartment, and then just draw this transverse, though it is like this, right? And then it gives deep posterior and the superficial posterior compartment, and we all are experts into the superficial posterior, because gastrocnemius, soleus, and the plantaris, right? Done, finished. And in lateral, so we know it so well because there are only two members, peroneus longus and peroneus brevis. And where is the third one? That is peroneus tertius. Well, that is in to the anterior compartment, right? In anterior and anterior, so there is tibialis anterior. So let's put over here in different color the tibialis posterior, right? That is into the posterior compartment. And another thing is that it is the anterior when it contracts, so it gives extension, right? So we do have say extensor hallucis longus, extensor digitorum longus, right? That is over there. And this peroneus tertius. Tertius was number 3, right? And similarly, no partiality between say anterior and posterior. So if anterior compartment has got these 4 muscles, similarly, right? So these 4 muscles, tibialis anterior, flexor hallucis longus, flexor digitorum, extensor hallucis longus, extensor digitorum longus, and the peroneus tertius. So here also things are quite similar. It is tibialis posterior, flexor hallucis longus, flexor digitorum longus, and P for P. So over here it is the popliteus, right? Done. All the muscles are done, but we have not yet touched this group, right? That is what we'll see in more detail tomorrow, and then we'll be going for that entire muscles redefined, right? And we'll give it the part dukes, that is the second part, right? So that was initially it was 1, then we'll go for 2, so that all the muscles, once you revise, right, for your revision, muscle redefined part 1, part 2, you do that practice, it's done, right? Entire lower limb would be completed. Okay, so just this was like a brief intro, and what we'll do is we'll keep on repeating this figure 2-3 times. Then in the next section, right, we'll be putting some arteries, then we'll be putting some nerves, so that way things would be very clean. Okay, so this is about just this is perforating vein. Okay, this is deep to that investing layer of fascia. Okay, and now we are on to our main things. See, this is popliteal fosa, correct? This is popliteal fosa. Now in popliteal fosa, that is back of the knee, we are watching first the major structures, then step by step we'll start discussing all of them. The striking one, this is plantaris, right? This is plantaris. We know plantaris very well because it is into the posterior compartment, right? Then there is gastrocnemius, medial and lateral head. Just underneath there is that second heart, right? That is, you are right, that is soleus. And then this plantaris, which are a very simple Siddha Sadha, right? He'll go all the way, and then to it's only the tendon is traveling, his muscle belly, so is very thin, and then it goes all the way lower. Okay, so as we pull it on one side, we see 3 major structures, right? We see 3 major structures. See, let me zoom it. This one, this is bit whitish, deeper, right? That is popliteal artery. Yeah, actually, instead of writing popliteal, this pop looks more appealing. Eh? It looks stylish. And this darker one, right? It is popliteal vein. And then we have got these white structures, right? Just can't miss it. So that is the tibial nerve, right? This is just a minute, right? Let me make some space for it and let it be more clean. So this is tibial nerve, right? And yeah, this was popliteal vein. Now see, these popliteal arteries and veins, they are traveling together, right? They are traveling together. What they do is they just go down and then they disappear between those two heads of gastrocnemius. So then you have got the gastrocnemius over here, right? So that's the point. That's the point where this popliteal artery and vein, they go into the substance of, say, two heads of gastrocnemius, right? This much is sufficient. Gastrocnemius. Okay. You must have guessed. In our next session, yes, next image, we'll be removing the gastrocnemius, right? So that we can have a better look at it, that what really happens as it goes down, right? One more important thing. As we said that arteries and veins, they are similar. So from this point onwards, we'll be removing all the arteries. We'll be just having a look at the, we'll be removing all the veins, and we'll be having only the look at our arteries. No, images are absolutely fine, right? They are absolutely fine. I don't think there is any problem. In fact, many of the images, they are the same which were used last time. Right? They are all same. Because in case if there is any problem in the internet, then you might be getting some blur thing. But because it's fine for everyone, so there should not be any problem. No, speed over here, I have just checked it. Yeah. See, it is clear for everyone. So just check it out in case if you have got the internet issue, or just refresh the screen, things should be fine. Okay, coming back to this. As we'll be removing all the veins, right? So we'll be looking at only the arteries. So here it is, that's our popliteal artery. So now entire focus will be on popliteal artery, right? Now we know that popliteal will be giving branches to gastrocnemius, right? That we have already seen. Now our purpose is that what happens to this popliteal artery as it proceeds into the leg, right? So what we have done, I will be writing over here, that is the branches to gastrocnemius, right? Gastrocnemius has been removed. Clear? So here, as we'll proceed, this popliteal artery will be giving three major arteries, right? It will be giving three arteries. One, anterior tibial, right? And we'll very soon we'll be putting these arteries into our that cross section also, so that it is crystal clear. Then when we'll be discussing the nerves, so we'll put that common peroneal, that superficial peroneal again into that cross section. And then we'll see the universal law that whosoever is near will be supplying them. So that's where we'll see that which nerve will supply which muscles. You don't have to cram, just that section you remember, and everything would be easy. Okay. Then the second which we'll be watching is posterior tibial, right? Posterior tibial. And the last one, that would be the peroneal, right? All of them, they are kids of popliteal artery. Okay. So here it is. Now see, we have removed gastrocnemius, right? So once you remove gastrocnemius, obviously you come across soleus, right? Soleus is next. But in case of soleus, we do need to remember one thing. And what was that? That is when we saw that origin of soleus, right? There was a defect, right? Soleus arises from tibia as well as fibula. So in between there is a space, right? And that was what we said, the fibrous arch of soleus, right? So here it is. See, this is what? That is Popliteus, correct? That is Popliteus. And this one is soleus. And it is this arch, right? This whitish one, that arch. That is the fibrous arch of soleus. And through this arch, right, these popliteal vessels, they will be passing. So we just see that fibrous arch, right? Fibrous arch of soleus. Good. Let me remove this so that you can have a very clear picture about what we are talking about. Okay, here it is, right? Seen still more clear. Now in this, say it goes through that fibrous arch, right? And that's the soleus, right? See, it is going in this, and this one would be the Popliteus. Fair enough. That's the area which I'm talking about, right? Okay. Now see, guess what we have done? Soleus is removed. So once soleus is removed, right, now we have, what we have done is gastrocnemius removed, soleus removed, plantar is, so in any case it's a very small one, so that has been removed, right? It means now we'll be coming across what? We'll be coming across that transverse intramuscular septum, right? Transverse intermuscular septum. So watch carefully how exactly it's arranged, right? Just for the reference, right, we do have at our base the Popliteus, right? Why this is Popliteus? Because the next one, right, deeper one, that is the deep posterior. So we have removed superficial posterior, right? Superficial posterior is removed. All the muscles of superficial posterior, gastrocnemius, soleus, plantar is gone. And that's the plane which we are watching. So it means this particular plane is between those two posterior. True? Right? Between the deep posterior and the superficial posterior. And Popliteus is a muscle of deep posterior. And along with it, just for the remember, just right, recollect which other muscles were there. Right? Just recollect. Okay. Now watch this particular level. I'm taking a different color. Right? Watch the level where the Popliteus muscle is there, right? So that's the level of Popliteus. Okay. So like this. So that's the level. It is at this level. Because we need to remember, because it is at this level when the anterior tibial will be emerging. So this is anterior tibial. Now we could have straight away labeled it that, okay, this is anterior tibial, this one is posterior tibial, this one is posterior tibial, this one is peroneal. That's fine. That's fine. We can always do it like that. But when we define the level, right, it will help you a lot, especially when you will be going for surgery, right? Many of these landmarks, right, they'll be helping you a lot. So this is the anterior tibial. Name itself is telling anterior tibial. So it has to run forward. So it will be, so it runs forward, right? That was easy. Posterior tibial, here it is, right? So that is anterior. It has to be posterior. So this is also very easy. Posterior tibial artery. Okay. Only one is left out, and that one is who will be going into that lateral compartment. Lateral compartment, also called as the fibular compartment, also called as the, you're right, peroneal compartment. So let's name this thing as peroneal artery. Pretty easy, right? Pretty easy. Okay. Let's explore further. We remove few more muscles, right? See, this time what we are watching is, as it will go down, we'll be going for that transverse intramuscular septum, which will become thicker and thicker and thicker as it goes down, because later on it will be merging with that retinaculum, right? Okay, so let's put our, so we are on the back side of the leg, right? So here, this one, now our focus is on posterior tibial artery. This will be going just behind all those, right? Behind the posterior group of muscles. But important is here, right? We'll have another look at it. But this is where, this is transverse intermuscular septum, right? So as such, it is between sandwich of those muscles, but now it will be going under transverse intramuscular septum. So it is at this point where it would be covered by, right? It would be covered by transverse intramuscular septum, and as we proceed, right? See here, it is seen much better. So now we have got another look. Okay, so that's right. See, I just zoom it, right? Everything, this whitish portion, right? That is all transverse intermuscular septum. Fair enough. And that's how it goes underneath. Okay. Unzoom. Moving on to the next one. See here. Now it is better, right? Because what we have done is we removed even this transverse intermuscular septum. So that has also already been removed. Now we can see the full. This is posterior tibial artery, and what it is doing, this posterior tibial artery, nothing much, right? It is running behind. Which muscle would be over there, right? See, it would be tibialis posterior, right? Because now we are dealing with the deep posterior, and this location is for tibialis posterior. So remember, I'll put the star. It runs behind tibialis posterior, right? All you need to understand is just keep on thinking about the compartments in which it will be moving. It goes behind superficial posterior muscles. Yes, that's right. That's right. Obviously, all superficial posterior muscles, they were what? Gastrocnemius, soleus, and plantaris. All those muscles we have removed. Then and then we are watching it, right? So it would be running behind those muscles. True. You are right. Okay. So now it is going behind tibialis posterior. Now think of it. When it is running behind tibialis posterior, so if I ask you one question, right, and I'll wait for your answer, that means posterior tibial artery right now, when I'm writing it over here, is in which compartment? Is it in anterior? Is it lateral? Is it deep posterior? Or it is in superficial posterior? Out of these four compartments, if I just speak this sentence, that posterior tibial artery is running behind tibialis posterior, so it means where will you place posterior tibial artery? In which compartment will you place? Right? I'll wait for the answer. That's right. That's right. It has to be deep posterior, right? So when we'll draw a cross section, now we know that yes, no doubt about it, posterior tibial will be into the deep posterior. That's right. Okay. What happens further? Now at the ankle, right? At the ankle. Excellent. Everyone has answered it correctly. Very nice. So at the ankle, this artery passes beneath flexor retinaculum, right? Now see, when it is This is flexor retinaculum. Now in flexor retinaculum, we do watch this and this, right? We watch this. They are nothing but medial and plantar lateral arteries, correct? They are the medial and the lateral plantar arteries. So that's what really happens. So at the ankle, this artery will pass beneath the flexor retinaculum, and then it divides into these two, right? Medial plantar artery and the lateral plantar artery, right? This one is medial and this one, right, it is lateral. So that was, say, if I really draw it like, say, we are dealing with this image, right? We are dealing with, say, this one. So just for our understanding, right? This one would be what? Tibia. This one would be what? Fibula, right? Then this is like our interosseous membrane, right? Then that interosseous membrane, right? That interosseous membrane, and let's draw it like this, right? And then we have got anterior and posterior, and then we go all the way. This is transverse, all the chambers and everything known to us, right? We just add one thing, and that is that we talked about this posterior tibial, right? See over here, we talked about posterior tibial, right? So that posterior tibial, it has to be into one of the chamber, and that one would be right, the deep posterior, right? Here it is, right? So one part is clear, that this is posterior tibial artery and vein, right? Because veins will follow the same thing. Okay. Just a minute. I need to orient it properly. Say, because this is fibula, right? So we'll draw it. It has to be over here. It has to be over here. Yeah, it has to be over here. This one would be behind the tibia. So posterior tibial artery and vein. Done. And as we have drawn this near the fibula, so we'll call it peroneal artery and vein, right? That would be peroneal artery, because this peroneal artery later on, right, we'll see that where it goes and what it does. And finally we'll just put one more, and this is over here, and that one would be anterior tibial, right? Anterior tibial artery. So it means this anterior tibial, it will be going into the anterior compartment, right? Okay. Meantime, just for a very high speed revision, right? This was gastrocnemius, this is soleus, and that is plantaris, right? Over here, which muscle into the anterior compartment? It is tibialis anterior, and the extensor hallucis longus, extensor digitorum longus, extensor hallucis longus, digitorum longus, and over here this is peroneus longus and peroneus brevis, and their third partner would be over here in the form of peroneus tertius, right? So in the posterior we have got the tibialis posterior, we have got the flexor hallucis longus and the flexor hallucis brevis and the popliteus, right? Finally we have, what have, see the fun, what have I done, right? I wrote that thing into tibia. This is peroneus longus and peroneus brevis. Okay, so these are the muscles. Well, not this one is bone, right? So now it is fine. So they are bones. Now all okay. Let's go further. So peroneal artery, right? It passes laterally. Yeah. That's what I said. Corrected. Okay. So this one was deep peroneal. Now this deep, this one was, right, tibialis over there, the posterior tibial, right, which we saw, posterior tibial artery. And this one, the next one, that is our peroneal. Now when we say about that, right, the peroneal artery, it passes laterally, right? So this passes laterally. And when it passes laterally, just in any case, we'll be watching this thing in detail tomorrow, but at this point of time, we just remember that it goes underneath flexor hallucis longus, right? So right now we just remember this, that it passes underneath flexor hallucis longus, and that flexor hallucis longus is this, right? So it just goes underneath. Here it is. This is the point what I'm mentioning about. Okay. Okay. So obviously to see this thing, we just remove flexor hallucis longus. And as we see that straight away, it runs down, right, into that deep posterior muscles, because these are the deep posterior muscles, and it is close to fibula, right? See, we are talking about this, close to fibula, and it is deep to all these muscles, right? That's where it is going. Okay. So we removed this flexor hallucis longus, and it runs down, and it is close to fibula. I'm just giving you all the keywords, right? Close to fibula. That's what I'm talking about here. Okay. So all these muscular branches, they are given, right? See, it is giving all those branches, right? Several muscular branches, several of them. And finally, it just ends behind this lateral malleolus, right? So here it is, it ends behind, and that's the lateral malleolus. Right? So in this, we are watching quite properly, but here it is, someone who was at the level of that Popliteus, and this one is anterior tibial. Now this anterior tibial has to go anteriorly. If it has to go anteriorly, it has to pierce, right? It has to pierce interosseous membrane, right? So it pierces through that gap in interosseous membrane, right? Interosseous membrane. So that's the important thing for this anterior tibial. Moving further, now we rotate the entire leg, right? So that now we are watching from the anterior aspect, so that we just take that muscle on one side and we see just for the reference, this one is tibialis anterior, right? So now we know that one is tibialis anterior. It runs down because as it pierces the interosseous membrane and it comes out, and here is its emergence, right? Emerges here, right? And then it is running down all the way, right? See, it is going down, and this white structure is what? Nothing but it is interosseous membrane. It is interosseous membrane. So this runs on interosseous membrane all the way, right? And this one, as we said, that this is tibialis anterior. So here, just by the look, immediately we know that it is lateral, right? It is lateral to tibialis anterior, right? And on interosseous membrane. After it pierces interosseous membrane, as it goes from posterior and it comes on the anterior side. See. So here, right, we watch that yes, it is going all the way down. Now we will start removing more muscles, right? So this anterior tibial, as it is going down all the way, right? It is going down. Here is the extensor retinaculum, correct? Extensor retinaculum. And retinaculums, so they are like they cover everything. So this anterior tibial artery has to pass through tibial artery. So it passes underneath, right? It passes underneath extensor retinaculum. So that's perfect, right? Because all these things, they can be asked very easily into the question, that is in the exam, in the test. The next one, anterior tibial artery, right? See, the name would change now. It is the same artery, but after one level, the name would be changed. This anterior tibial artery feels like that I need to change my name, and as it is going into the foot, and foot is called as pedia, so it tells that I am on the dorsal aspect. So let me be called now onwards dorsalis pedis artery, right? We don't mind. We will say, okay, we'll call you that. But from what level? From what level we should call you dorsalis pedis? We'll say, no confusion. This is what? This is extensor retinaculum, right? Extensor retinaculum. So as soon as this anterior tibial artery, it crosses and comes out, right? So we'll say this is extensor retinaculum. So from this point onwards, as soon as it comes out, so over here, we'll say this point, right? This point, or let's change the color, right? Or just put a dot here. This point. This would be the point from where it would be now called as the dorsalis pedis, right? That's the extensor retinaculum. Clear? Yeah. Yeah, that's the extensor retinaculum. You know that. You want me to write full? Okay. Extensor retinaculum. Okay. So that would be the important point. Right? Let's put a star. Okay. Now we move on to those nerves. In nerves, we are now dealing with two nerves. One, the tibial, and the second, common peroneal. Common peroneal nerve. So immediately we know that this part, this one is the tibial, and this is Common peroneal. Common peroneal is dividing. Yes, we'll see that. So here it is that first we are dealing with what? This tibial nerve. Right. So it is supplying gastrocnemius and soleus because that's where it is going, right? So this will be supplying gastrocnemius and soleus because that's where it is going into the contents of that, right? Gastrocnemius and soleus. So we remove gastrocnemius and soleus just to see this tibial is now properly, right? So let's remove gastrocnemius, gone, soleus, gone, right? And that's where we are watching this our tibial nerve very properly, right? Now this tibial nerve, when we draw it like, let's say we draw it like this, so this is tibia, right? That one is fibula, and this one is interosseous membrane, and this one is superficial, so we just draw it like this. This one would be the lateral one, and over here that's the transverse. So where exactly are we looking at? We are looking on the tibial side, right? So that's where over here, because on fibular side, so they were all peroneal, right? So here what we watched that this is the point, and let's say this is the nerve, right? So which pair is this? We are dealing with posterior tibial artery, right? Posterior tibial artery, and this nerve is tibial nerve. It has to be tibial nerve, right? And that's the tibial nerve with pairing with posterior tibial artery and veins. So this is the first pair which we talked about. That's the residence of this first pair. Okay. Now this particular tibial nerve, it goes down. Quite simple, right? Quite seedha sada, right? It keeps on going down, and then see. In any case, that flexor retinaculum has to come, so it will come. Here it is, flexor retinaculum. Right? So here comes the flexor retinaculum. So it has to pass underneath, right? No wonder. So this is tibial nerve under flexor retinaculum. Now actually this retinaculum is like this, right? But to see something, we have just removed a small portion so that properly we can see the things which we really want to see. So zoomed version, so that we don't confuse between medial and plantar arteries. What we just saw, right, just before few minutes, what we saw that these were medial and lateral plantar arteries. We need to watch that under flexor retinaculum, this tibial nerve will also divide into medial and lateral plantar nerves, which will be following the course of the arteries, right? So where exactly are they? See, first I'll just draw on it, and then you'll know that yes, it is there, right? See, the nerve is coming from here, right here, and then just underneath it, right, it divides, and then can you see a structure which is over here? Don't worry, I'll remove all these colors, right? But right now just you need to appreciate where exactly it is. And then from here, right, from here it divides, because this division is underneath the flexor retinaculum, right? And here is the thing. Here it goes, right? So we have this structure, or let's change the color. We have this structure, and we are talking about this structure. So they are medial plantar nerve and the lateral plantar nerve, right? So this is medial plantar nerve, and that one would be the lateral plantar nerve, right? Now let me remove this yellow color so that you can appreciate that. Yes, we can see those. Now see, that one is easy, right? I remove this, I remove this, and I remove this, right? Let that drawing on the retinaculum as it is, right? Now I'm zooming it, so see, right? Can you really see properly? Here it is one, and here it is this second, which goes all the way like this, right? Good. Okay, unzoom. Still better, right? This is a zoomed version. So here it is one, and here it is two, right? This is medial plantar nerve, lateral plantar nerve, right? Division is just underneath the flexor retinaculum, right? Okay. Now this one, right? This will be supplying whom, right? The tibial nerve would be supplying. So this tibial nerve, right, would be supplying gastrocnemius, soleus, plantaris, right? Plus it will supply 3 deep flexors, right? In other words, everything which was there into deep posterior. Now, as such, if you see whether deep posterior or superficial posterior, these are the guests of superficial posterior, correct? This is of superficial posterior. So it supplies them also, and it supplies to all those deep posterior also. And deep posteriors, they were what? Flexor hallucis longus, flexor digitorum longus, right? Those two which we have not yet touched, and the popliteus, and the main one, right? Tibialis posterior. So that's what it is getting supplied, right? This way and this way, right? Right. Now this is common peroneal, right? Common peroneal, because it was dividing into only two. One was tibial nerve, and the common peroneal. So here is our common peroneal. This common peroneal will very soon be divided into superficial and deep, right? So here it is. This one is superficial peroneal. No. And this one, other one, it is the deep peroneal nerve. Now do remember that our cross section, right? So we'll start putting it into that. Superficial peroneal, right? That is easy. So let's finish it first. So here it is, this superficial peroneal, right? Superficial peroneal. No, it will go beneath. Now this is peroneal compartment, right? Peroneal. So this is where it will be going into this lateral compartment. And in lateral compartment, we are dealing with peroneus longus and the peroneus brevis. It was the peroneus longus which was bigger because peroneus brevis so was bichara chota sa muscle, right? On top of it, that peroneus longus was coming. So this is getting sandwiched between peroneus longus and brevis. So we can very safely write that or say that it will be going beneath peroneus longus. All right. And then what it does, right? And it continues as sensory nerve, right? It will continue as sensory nerve. So that's about peroneus, superficial peroneal nerve, right? Peroneal nerve. Now, peroneal nerve would say, because I am over there, right, nearest would always be supplying. So, no big rocket science, even if you answer this question correctly, that which are the muscles supplied by superficial peroneal nerve, right? Because this nerve is into the lateral compartment, and in lateral compartment, we do have peroneus longus and peroneus brevis. So they both would be supplied. So regarding the sural nerve, why we are not touching it right now? Because see, let those muscles come which will be actually playing a major role when the sural will be supplying to that, right? Otherwise, say it would be like just a piece of information, right? So don't confuse. Forget sural nerve right now, right? It will come, right? When those muscles would come. So here, superficial peroneal nerve, right? That would supply peroneus longus and peroneus brevis, right? Then we do have deep peroneal nerve, right? Deep peroneal nerve, because that's the only nerve now which is left out. Deep peroneal nerve was going where, right? Let's draw this, right? A very high speed. So this is what tibia. This one is fibula. Even you can also start drawing it, right? Interosseous membrane, and this tibia is cutaneous, so that's why we drew it like this. And then this is and then just take one and done, and we have got, right, all those chambers ready, right? All those compartments ready. In this, the deep peroneal nerve, right? Deep peroneal nerve, that's the location, right? Let's take all the yellow. This one is here, right? This is what? That one would be the tibial nerve, right? This is the tibial nerve. And we saw that tibial nerve will be supplying here, right? So over that peroneal, that is the common peroneal, right? That common peroneal, so that was still in deeper, but then it got divided into superficial peroneal and deep peroneal. So this is the area now. This is the superficial peroneal nerve, and this superficial peroneal nerve, that will be giving two muscles over here, peroneus longus, peroneus brevis. Done, right? And then we do have this deep, or why are we writing, right? This one, right? So that is the deep peroneal nerve. Now they are accompanied by which vessels? Well, this is easy. Anterior tibial artery and veins, right? What about this? Well, this one would be the posterior tibial, right? So that is also not very difficult, posterior tibial artery and veins. And those peroneal arteries and veins, well, they are not into the lateral, they are just behind over here. So this one is the peroneal artery and the peroneal vein, right? Muscles, you know them, right? Three muscles which we are expert in that, right? over here. So there is a musical relation between this anterior chamber, that is the anterior compartment, and the deep posterior, right? The names and everything is so musical, so you know that, right? Yeah, peroneal is on the lateral side. Yes, that's right. Right? So common peroneal is into the deep. That's right, deep posterior, because that's where it will be dividing, and done, right? Okay. So let's see them. Let's see them, because this last few figures, few images, they are very vital. As we said that this is going under Peroneus longus, right? This one. So this one is Peroneus longus. And as we pull this muscle on one side, right? That's where we watch our nerve. Now see, just for the reference, right? This is okay, this is anterior, this one. So that is our tibialis anterior, right? And let me remove this first. And this muscle, right? In next image we'll see rest of the structure. This is extensor digitorum longus, right? Extensor digitorum longus, right? Don't worry about this, just because it is coming in between, so that's why I just wrote the name. Otherwise don't worry, right? Tomorrow as such we'll be talking about it. So we just take that muscle on one side, right? This is tibialis anterior, right? That is one, and we take that muscle, and that's where we really see the deep peroneal nerve. And along with, right, along with those anterior tibial vessels, right, along with, so with anterior tibial vessels. Let's see further. Yes. See, we are following down. We just follow it down, right? Making it more clear. And this is the point. This is where it will be going underneath. Now it will be going underneath extensor retinaculum, right? So underneath, sorry. Extensor retinaculum, and it will supply, right? It will supply whom, right? So muscles by deep peroneal nerve, they must be into the anterior compartment. True, because it goes there, and here it is, the tibialis anterior and the peroneus tertius, right? The peroneus tertius. This one is our extensor retinaculum, right? See, this one is the extensor retinaculum. So that's how it goes underneath. Now from this point onwards, things are into the foot. So that's where we'll start from tomorrow. In foot, we'll be taking the entire foot in a very different way, right? All the structures are there. So we are left out with four muscles, right, which are into the leg, and then there will be few others, those small muscles. So step by step, we'll reconstruct the sole, and that within 2 sessions, that's what I guess, 2 or at the most 3 sessions, we'll complete the sole, right? Then we might give, depending upon the availability, a 1-day gap, and then there'll be the grand exam, right? So thank you so much, and tomorrow we meet at the same time, right? Saving this file, and it will be put into our shared folder, right, within a minute. Thank you, and bye-bye. See, one question I tell you, one thing I tell you, because we have, I told you that 4 muscles we have not touched, deliberately we are not touching, right? So why the questions on those muscles? I know you know it so well, but again I'm telling, when we said that we are not touching extensor digitorum longus, extensor hallucis longus, flexor digitorum longus, and flexor pollicis, so then why are we touching those muscles right now? It's like, say, you know it well, but think from someone who is constructing, right? Those who are just learning it for the first time, right? Because all those sural nerve and these other muscles, everything would come tomorrow. So keep patience, right? It will come. We are building the whole thing in step by step way. Otherwise, in single shot, we could have taken, okay, these are the compartments, these are the muscles, just forget. That's it, done. We could have finished this topic within 15 minutes, right? We are not doing it. So keep patience. Thank you.